Half of people with Parkinson's disease use natural remedies, and many hide it from their doctor for fear of how they will react. Natural remedies are complementary medicine, never alternative. Let's describe the role of ginkgo biloba, mucuna, fatty acids, green tea, and exercise. And we will also mention turmeric, bioflavonoids, emotional hygiene, different diets, sensory diet and massage, aromatherapy, Bacopa and other plants, music, among others. All these remedies appear detailed in the different chapters of the book. Among the plants, Mucuna plurians stands out, a species of bean that grows in the tropics and that contains a large amount of pranatio. Pranatio levato is faster acting, longer lasting, and less toxic. Ginkgo biloba calms anxiety without causing drowsiness and prevents patients from falling asleep during the day when taking anti-parkinsonian drugs. It improves memory and attention, and in experimental animals acts as a neuroprotector. It is contraindicated with anticoagulants. Ginseng can be useful as a mental and physical activator. It prevents drowsiness due to drugs, raises mood and libido, compensates for drops in blood pressure, and therefore should not be given to hypertensive or cardiopathic patients. Do not mix with anticoagulants or stimulants. Turmeric opens new horizons in the treatment of Parkinson's, modifies the expression of genes related to aging in laboratory and prolongs their life, and it's neuroprotective. Its antidepressant effect is comparable to fluoxetine. Passion flower improves tremor without the problems of anticholinergics, and also relieves anxiety and insomnia without the side effects of benzodiazepines. That is why it can be very useful for people with Parkinson's disease. Govata plant seeds relieve constipation because they increase gastrointestinal mobility and thus are better absorbed. Levodopa and other medications. This produces a clear improvement in Parkinsonian symptoms. People who drink tea are less likely to suffer from Parkinson's disease in patients. Green tea increases the effect of medications, contains polyphenols that are neuroprotective and act similarly to cardidopa and monoamine oxidase inhibitors. In addition, it provides theine, which increases mental alertness, and theophylline, which improves tremor and motor ability. The Aztecs already knew about chocolate. It provides nutrients, flavonoids, and psychoactive substances, theobromine, phenethylamine, and produces feelings of reward and pleasure. That activates dopaminergic systems, releases endorphins, and improves mood. People with Parkinson's and depression drink more chocolate, perhaps because they sense that they need it. Bacopa strengthens memory and other cognitive functions. It acts similarly to anticholinesterase drugs used in dementia and monoamine oxidase inhibitors prescribed in Parkinson's in animal models of toxic Parkinsonism. Bacopa is neuroprotective. Ayahuasca is a magical brew that is used in Amazon rites and with its Banisterian component. It has very peculiar psychoactive properties, and its pharmacological actions are being investigated, which are very interesting. It could open therapeutic horizons to improve Parkinson's disease. Currently totally contraindicated, and its use is illegal. In hemp or cannabis, there are ingredients that improve patients with abnormal movements. It has been shown to be useful in multiple sclerosis, tremor, tics, and dystonias. The problem is the possibility of creating addictions and the memory alterations it causes. There are other plants that can influence symptoms of Parkinson's, most of them of a historical nature, since we advise against them and are usually contraindicated: Centella asiatica, campoerba, galanto, cornezuelo, monk's pepper, St. John's wort, veleno de stramonium. There are non-energy nutrients, such as vitamins and vitaminoids and nutrients themselves, which also provide energy. Flavonoids, resveratrol, essential fatty acids. See nutrients. No vitamin or nutrient prevents Parkinson's disease, but some combinations of them delay the evolution due to their antioxidant effect. Those who take multivitamin preparations have a lower risk of Parkinson's, and if they do suffer from it, symptoms appear about 3 years later. Folic acid is neuroprotective. prevents physiological aging and reduces the risk of Parkinson's. It also lowers dangerous homocysteine, which is usually elevated in Parkinson's patients. All people treated with levodopa should take folic acid. Flavonoids are pigments from plants such as citrus fruits or forest fruits. They are neuroprotective antioxidants and in animals with experimental Parkinson's prevent lesions of the substance. Emigrate. Resveratrol is abundant in the skin of red grapes and wine, activating sirtuin, an enzyme that activates genes and prolongs life in laboratory animals. It is antioxidant and prevents neuronal damage in animals Parkinsonized with toxins. Essential fatty acids are lipids that we do not synthesize like omega-3. They're in bluefish, in flaxseed oil, and taken in supplements. If they are missing, neurons are damaged. A diet rich in omega-3 may delay the onset or progression of Parkinson's, Alzheimer's, and other neurodegeneration. In the food diets chapter, we discuss several types. The protein redistribution diet, the vegetarian high-carbohydrate diet, fasting, the raw diet, the paleo diet, etc. A Parkinsonian should follow a natural balanced diet. Low in calories, no animal fats, rich in carbohydrates. With proteins shifted at night, with a lot of fiber and a lot of liquids. Just as there are food diets, there is a sensory diet. The brain requires sensitive, appropriate, and pleasurable stimuli. In Parkinson's, massages that improve stiffness and bradykinesia, prevent contractures, maintain mobility, and relieve fatigue caused by tremors are very indicated. They reduce stress, facilitate sleep, and give a general feeling of well-being. Aromas produce emotional changes by applying essential oils during massage. There is relaxation and a feeling of well-being that is very useful for people with Parkinson's disease. Music and dance can reorganize damaged brain functions. In Parkinson's disease, they relieve symptoms and improve patients' gait and overall functional capacity, giving them the kinetic melody they lack to prevent and improve Parkinson's disease. Is emotional hygiene necessary? Parkinsonians have poor strategies for coping with stress, and that worsens their symptoms. They need emotional management, learn to defer stress, and enjoy with a hedonistic attitude. And they have to learn to enjoy, avoid sad people, and reject negative thoughts. The best natural treatment for Parkinson's disease is exercise and physical activity, especially outdoors. It improves muscles and joints, releases endorphin, relaxes, increases dopamine, and promotes neuronal plasticity. There are two types of Parkinson's: the ones that go bad because they only take medication, and those who live longer and better because in addition to taking pills they exercise.